Prostate cancer screening typically begins when a man reaches 50 years of age. If he has increased risk factors, such as having a first-degree relative having prostate cancer, such as a father or brother, or if he is African American, those are risk factors for having prostate cancer and should be screened earlier, typically at the age of 45. These days, as you know, screening for prostate cancer typically consists of doing a blood test and doing a digital rectal examination, which is essentially a physical examination done in the doctor's office. There have been a lot of controversy in the last several years in regards to who should be screened and whether or not we should in fact screen for these patients. If the patient decides to and elects to have a screening program done for prostate cancer, then he should undergo a physical examination with the blood test. If either the blood test is not normal, meaning the blood test is too high, or if the rectal examination is abnormal, such as a lump or a mass or a tumor, if either one of those studies are not normal, then the next step would be to do a biopsy to confirm that there is indeed cancer versus it being other causes such as inflammation or trauma or just having a big or an enlarged prostate gland in and of itself. At this time, in terms of prevention of prostate cancer, there is really no way of preventing prostate cancer. We believe that it's a multifactorial disease, meaning you just get it sporadically, or it can be genetic or familial where you inherit a specific gene. We still don't know what gene causes it, but we do know that if your parents, specifically your father has it, or brothers have it, siblings have it, that you are at increased risk for prostate cancer. However, even if we know that your father has it or your brothers have it, there is no specific treatment in terms of delaying or preventing from getting prostate cancer. The different treatment options for prostate cancer include some form of radiation therapy versus having radical surgery. Now, radical surgery consists of removing the entire prostate gland, the structures around it, and then reconnecting all of the urinary tract so that there is no bag that is required after the procedure. If one elects to have radiation therapy and preserve their prostate for personal reasons, that consists of having radiation delivered to the entire prostate and around the prostate area. There are different and various forms of giving the radiation therapy called high dose rate radiation therapy, also called HDR, versus external beam radiation therapy, which is a form of radiation therapy where radiation is delivered over a 6 to 8 week course, not requiring any type of surgical intervention, or another procedure called brachytherapy, where we implant little small pellets into the prostate to specifically treat and destroy the prostate in its entirety. Those two forms of therapy are considered to be definitive therapy for treatment of prostate cancer, either through radical surgery or some form of radiation therapy. When it comes to either one of those forms of therapy, it really depends on the prognostic factors of the patient's biopsy and the characteristics of that biopsy. Those will help determine which form of therapy would be best for that patient. The recovery time for treatments of the various options are different depending on which option a patient elects to undergo. The options for surgical intervention include about a 6-week disability period in which the patient really should refrain from doing anything really strenuous or any type of activity that would require use of abdominal muscles. This requires typically an incision in the lower abdomen, or it can be done laparoscopically through little small telescopes or via using a robot. Nevertheless, around a 6-week window of just refraining from strenuous activities is recommended. When a patient elects to undergo any type of radiation therapy, there is no cutting or typically sutures that are required. Because of this, the recovery is much more quicker. If the patient undergoes external beam radiation therapy, there really is no downtime. Patient can go to work during that period of time and maybe to exercise and do his normal daily activities. If he elects to have brachytherapy performed, which is an implant into the prostate, there may be a downtime of 1 to 2 days just to recover from some discomfort. Outside of that, however, there is really no specific restrictions during that period of time. The different pain management options really depend on which route the patient decides to be treated with. When a patient undergoes a radical prostatectomy, which is removal of the entire prostate gland, that requires more narcotics than if the patient undergoes radiation therapy. Radical surgery typically requires oral narcotics for pain control after surgery, which is usually required for 1 to 2 weeks post-operative phase. During that period of time, however, the patient can ambulate and do his normal routine, and the pain is typically not bad enough where it restricts his activities. When we talk about radiation therapy, however, There are no sutures or cutting, and typically is controlled with just Motrin or Advil or another non-steroidal inflammatory medication. Those medications are typically taken on an as-needed basis and sufficient enough where the patient can ambulate and do his normal daily activities. Prostate cancer surgery can be performed using transfusion-free techniques. It requires the meticulous suturing during the procedure. The procedure typically takes about 2 hours to perform. If done correctly and the patient's metabolic condition is adequate, typically it can be done without the requirement of transfusing the patient. When we talk about radiation therapy, it typically does not require any transfusions as there are no sutures or cutting. However, if the patient undergoes an implant for radiation therapy, such as an HDR implant or brachytherapy, that does require a small, minimally invasive procedure. However, there is no cutting. Because of this, there is a small but very rare chance bleeding may recur and may require blood transfusion. The post-operative care for radical surgery typically requires around a 6-week window of non-strenuous activity. Because the patients are typically sent home with a catheter for several days, this is somewhat limiting in their activity. However, as we mentioned earlier, they are able to ambulate and have a regular diet as tolerated. They should refrain from doing any strenuous activities such as exercising, running, or jogging. I think that it's very important to discuss the screening options for patients when it comes to prostate cancer. In the last several years, there's been a tremendous amount of controversy in regards to screening for patients who we think may have prostate cancer. This should be a decision that's left between the patient and the physician, and they should decide the risks and benefits, whether or not they should be screened for prostate cancer, and indeed, if they are diagnosed with prostate cancer, should they be treated for it. We don't know if these cancers are life-threatening in certain patients versus others, and therefore every patient should be treated differently, and the discussion should be tailored between that specific patient and his physician.